Everyone, welcome. Let me see if I can share my screen here. Jennifer, am I taking over now? Do I have control?
I cannot see your screen.
Okay, give me just 1 second. Let me see. We love technology, don't we? Get your Zoom. It will let me click on the share here. Here we go. How about now?
It looks like it's trying. Yep, it's there.
Great, thank you. Well, welcome everybody. Thank you for having me today. I'm excited to be with you. I am currently a trauma program manager, which is a little bit different than my role as an APP. But I left full-time practice a year ago, and am now a trauma program administrator. As Jennifer said, a lot of us have different ways we got to be a trauma NP. Most of my nursing background is in pediatric emergency, pediatric critical care, and transport. And just for the fun of it, this is a really neat case on the left. This is a little boy who was on the bus and the bus stopped and fell forward, and he had a pencil in his chest, hit no critical structures, but was pulsatile. So those are kind of some of the fun things we get to do as trauma nurse practitioners. My education, I got a bachelor's degree. This will be my 25th year as a nurse come May. I got my master's from the University of Alabama at Birmingham in pediatric acute and chronic care, and my doctor of nursing practice from the University of Mississippi Medical Center as well. And mostly that's just because they paid for it because I was already a nurse practitioner there. The large majority of my career, with a few exceptions of a short amount of time in adult ER, have been in children's hospitals. So my first job was at Le Bonheur. I've spent a good bit of time at the University of Mississippi Medical Center, where I was the lead NP for pediatric surgery and trauma. And that is Mississippi's only level 1 trauma center and only children's hospital. I also worked at the Children's Hospital of Philadelphia at CHOP and DC Children's. And then my first job as an NP was at Children's Medical Center, Dallas, where I did trauma neuro ICU as an NP and also practiced on their trauma service. Currently, I do serve as a trauma program director at Mississippi Baptist Medical Center, which is about a half a mile from UMC, this 80-something acre campus in our level 1 trauma center, where I have built a brand new trauma center, which does also see children's. We're also a burn program for the first time in the organization's history. So my experiences as an NP have led me to other places. So I do serve as that trauma program director. I'm also faculty currently for Emory University and have served as the PNP and NMP program director at the University of Mississippi Medical Center. I also serve as a consultant for the Mississippi State Department of Health, specifically in the Division of Injury Prevention and Violence, with special emphasis in statewide traumatic brain injury prevention efforts for children. And then I work for Baker Donaldson as a legal consultant. So what does a day in the life of a trauma NP look like? Really, that depends upon the institution where you work. At my most recent institution at the University of Mississippi Medical Center, where I was the lead NP, we saw inpatients, outpatients. We worked in the emergency department, in the neonatal intensive care unit, in the PICU. Some of us were first assist and went to the operating room. Prior to 2013, we could actually operate independently and do small things. So for instance, if I wanted to put in a chest tube, we could do that in the operating room. Mississippi does not allow that anymore, but we can do it outside the operating room. We led multidisciplinary trauma rounds. We would see consults for trauma, wounds, and other surgical consultations as it was a combined services. In an academic medical center, we're also participating in a lot of conferences such as morbidity and mortality, where we're looking at outcomes and review. And then as other academic institutions, obviously we're teaching nursing students, we're teaching nurses, we're teaching residents, we're teaching medical students, OT, PT. So we're involved in a lot of education in an academic medical center. I also had outpatient responsibilities there. I developed a pediatric trauma clinic that was NP run. We also ran feeding access clinic, and my last year there, I developed the first pediatric concussion clinic dedicated to pediatric mild traumatic brain injury management in the state of Mississippi. So it really depends on where you work. Some institutions in Texas at Children's Hermann, they rotated where they spent their time. So a month in inpatient, a month in ICU, a month in outpatient. So it's really dependent upon where you work and how your system is set up. There are also a lot of other activities that we get to do as nurse practitioner. And this is the stuff that gives us personal satisfaction and additional meaning outside the hospital. So I mentioned education. We do a lot of education, not just in the hospital for patients and for students, but also community education. We do quality improvement activities in the hospital, outside the hospital. You may have opportunities to participate in research. Injury prevention, education, and outreach is a big focus of mine. We've been able to develop a Mississippi Public Broadcasting documentary. We go to the Children's Museum. This image on the bottom left is we did a video with Safe Kids and Parent and Child Magazine for how to fit a helmet. So we have lots of opportunity, in addition to advocacy, going to your legislative or legislatures or your Capitol Day, or even to DC to advocate for legislation to improve trauma care. And of course, any other type of community service that really helps support trauma care. So what does your professional journey look like as a student? And I don't really know right off the bat in terms of the participants. Some of you may not be in graduate school, some of you may be thinking about graduate school, but ultimately there are 3 routes, if you will, to obtaining education to practice as a trauma NP. If you are a nurse, which a lot of us are, there are 2 routes. I will say that the Master of Science in Nursing, from the education perspective, is phasing out. We are looking at the American Association Colleges of Nurses, the AACN, looking at making the DNP an entry to practice. And we've been given some timelines from the education standpoint when that is supposed to occur, which is 2025. And I don't think a lot of schools are actually there yet. But I took the traditional master's route, which is to get a Master of Science in Education. My degree track was a pediatric acute care nurse practitioner track. In general, states help guide and institutions guide what practice area you need to have been educated in to have a job. Before we had all these specialty tracks, a lot of my colleagues had FNP degrees. So they were family nurse practitioners who happened to have nursing experience working in ICU, and they were kind of grandfathered into that role because there weren't acute care pediatric specialty tracks, or there was only primary care specialty tracks. A lot of that is changing. At least in the state of Mississippi now, you cannot practice in an institution or get licensed unless your certification, which is the test that you take after your education program, is congruent with where you're going to practice. So I'm a pediatric acute care nurse practitioner. I would not be able to go practice in adult emergency care because I do not have the education and training to provide that care. Most Master of Sciences in Nursing take 1 to 3 years. Vanderbilt did have a 1-year program at one time, but it's pretty intense. I would say for those of us who didn't go straight through, even doing it part-time was a little bit of a stretch because I already had 2 children and were working full-time. The other option is a doctor of nursing practice, and there are 2 entry points for that. You can either have a Master of Science and then go get your DNP, or you can do what we call now BSN to DNP, and those have individual tracks for those nurse practitioner training programs. So peds acute care or primary care or adult geri or whatever you want to do, you can go from being a BSN to a DNP. Those take much longer. And most of those, I would say part-time, are somewhere between 2 and 3 years, depending on the number of hours that you take a semester. I think one of my other colleagues this morning is going to talk a little bit more about physician assistant training. So I'm going to leave that to them. So when you're in school, from an academic perspective, what are ways that you can help prepare yourself for a career as a trauma nurse practitioner? Well, number one is having academic excellence. Oftentimes I have students say, well, what do I need to know for the test? And my answer to them is everything. Everything you do in graduate school applies to the care you're going to be giving the rest of your life to people, and how well you commit yourself to learning that information and to applying that information really results in your patient's outcomes. From a clinical perspective, some of the things that you can really do are being present and engaging in every rotation. Seek out those learning opportunities and ask questions. There is, every time you're in a clinical environment, whether you think you are or not, you're on an interview. If you are teachable and moldable and you have an interest, people want to engage with you and they think, hey, that's somebody that we might could use on our service. From a clinical perspective, any clinical environment that will support trauma care delivery, like subspecialty surgical, like neurosurgery or orthopedics, ER, ICU, anytime you can have those rotations, if they're allowed in your program. I know in my program, we require certain clinical rotations, but not everybody does based on where you are and what facilities are available to you. The other thing is to, if you can, and your state allows it and your program allows it, get some clinical experience outside of your home hospital. Many of us, you go to school, you do your clinical, where you work, where you've been in, where training or where you went to undergraduate school. Sometimes it helps to get out to see a different perspective of how things are done. When you're finishing up your journey in education and you're looking for that job, find job opportunities that are really going to support your learning needs. We know that role transition is real. If you're already a nurse and you're thinking about going to graduate school, then most of the time you are at that, advanced to expert level. But when you go from being an expert nurse to just getting out of graduate school, you're back at a novice level, and it can be very frustrating. So you want to make sure you find a program that can really support you, find a mentor. I believe we've been working on some mentorship programs through PTS, and then find that job that's really going to help support and grow you and invest in you as a provider. Other things you can do is join organizations that are related to trauma, participate in injury prevention and outreach activities, any type of community service at all that can support trauma care. There's lots of disparity in trauma to address. Quality improvement research, and then that extra trauma education. When you get out, if your hospital doesn't require ATLS, take it anyway. If you're not TNC certified, even though it's more directed toward nursing, it helps solidify that approach to trauma care. So those are just a few things from the education perspective and really beginning through your academic journey into your early career as a NP. And again, not just any NP, but not just trauma, but any NP. The other thing that you can do is constantly evaluate your strengths and weaknesses. As you start your career, we all have strengths and weaknesses, and growth is going to continue across your career. I've been doing this 25 years. I learn something new every day. I try to be better at what I do every day. So really make that commitment to lifelong learning. Because as some of you who've even been in nursing just a few years, think about pre-COVID and how we handled things and how we manage things now. It's different. We're always growing and changing in healthcare. The other thing that I love about trauma, especially as a new nurse, and it took me a little while, even as a new nurse or a new nurse practitioner in trauma, is that it is a team sport. You are never going to be alone. You're never going to be in that room alone with the patient. The good thing about trauma is that when you work with a great team, there is collaborative problem solving. It provides an opportunity for innovation, your personal growth, your work environment is happier, which means that you have a decreased tendency to burn out. You can be better at what you do, have increased productivity. There's smarter risk taking. If you're all kind of looking at the same thing and say, okay, as a team, we're going to do this differently, then you have an opportunity to make safe risks. And it makes you be creative. Ultimately, all those things with everybody working together leads to better patient outcomes. All right, that's my spiel real quick, and I will turn it over to my partners.
Thank you so much, Michelle. That was great. Melissa, do you want to go next?
If I can get my shared screen. Okay, can you see it there now?
Yes.
Okay, perfect. So my name is Melissa. I'm one of the nurse practitioners at Primary Children's Hospital in Utah, and I work on the Pediatric General Surgery and Trauma team. I have a bit of a unique pathway in general because I'm from Canada. So I have kind of the international view of what it's like to do school in the US from Canada perspective, and then also work in the US. So I did my undergraduate degree at Memorial University of Newfoundland, which is as far east of Canada you can go. It's a little island. And that's where I completed my Bachelor's of Science in Nursing, which I graduated in 2018. And then I got my graduate degree, my Doctorate of Nursing Practice in Pediatrics from Johns Hopkins University in Baltimore in 2021. So kind of my timeline looked like in May of 2018, I graduated with my bachelor's back in Canada. I moved to Baltimore. There's a very extensive process with CGFNS, and it's a huge application that ultimately shows the Bachelor of Nursing degree I did in Canada is equal to a Bachelor of Nursing degree that would be in the United States. That can take months. So that was definitely a big barrier of moving to the States. But I got it complete and got my certification. So then I was able to go ahead and write the NCLEX, which I was passed and started working as a bedside nurse. So in August of 2018, I had hospital sponsorship with a TN visa, and I started working bedside. I worked at Johns Hopkins Children's Center on a medical surgical unit. At Hopkins, the pediatric hospital is divided by age. So I was specifically on the adolescent unit, which was also the trach vent specialty unit. So a lot of different subspecialties within my job as a bedside nurse. But I got to see a lot of the trauma patients where I was on the adolescent floor. And I love taking care of the kids. And it really sparked my interest in trauma. Because I was also international and on a visa, my time was limited. So I started working as a bedside nurse, and the next day I started my DNP program. And that was definitely busy because I had to be full-time working and full-time doing my doctorate just because of immigration purposes. So I worked full-time, both school and work. And then in June of 2021, I graduated with my doctorate of nursing. I did the dual pediatric track. So I graduated with my primary and acute care in pediatrics. Logistics passed. I wrote my PNCB board exam and I passed that. And then I moved to Florida and I started a kidney transplant job. As a NP student, I did a kidney transplant and nephrology rotation and loved it. So when this job came up, I decided to kind of go that route instead of the trauma route. I had done a general surgery, trauma, and burn rotation as well. All of my rotations were within Hopkins, and that was more of an immigration side as well, that I had to kind of stay in one location. But there was just no jobs that I could find at the time. It was like right after COVID. So I went the kidney transplant route and I did not like it. I knew I had to get back to general surgery and trauma. So in March of 2022, I started my job here at Primary Children's in Utah. And I am 2 years in like 2 days in this job. So as a surgery and trauma nurse practitioner, what do I do every day? My average day, I mean, it can definitely get chaotic, but for the most part, I do in the trauma bay, I actively run all the traumas, either doing the primary and secondary survey. I'm sometimes running them now at our sister hospital that we just opened 2 weeks ago. So the trauma APPs are directly running them. We also are the MT, like the massive transfusion protocol team. So if that gets activated, we step out of either the primary, secondary, or the running the trauma role, and we run the MTP. We just kind of do a rotation of roles within the trauma bay. And then we have officially opened our outpatient trauma clinic with our sister hospital. So that's something that I'll be working at as well. And that's like twice a month for 4 hours. And we kind of see all of our follow-up trauma kids. From an inpatient standpoint, we round every morning with our surgeons. This is on our inpatient trauma and surgery kids. We do all the daily orders and notes, kind of the expectation as a nurse practitioner, lots of patient education and parent education, and then we discharge and kind of coordinate all of the care with the subspecialty teams. In the ED, we do all of the surgery consults, all of, like I said, the trauma bay. We also surgically assist in the OR. That's definitely probably more of like a night shift thing because we are a 24/7 APP service. So the residents don't work overnight. So we are often the surgical assist. We also have a very intense telehealth trauma program, kind of the whole Intermountain Rocky West that we take care of. So I have multiple state licenses to cover that. So we will get on like a video call with an outside hospital, evaluate the child over video, and determine if they can stay at that hospital or if they need to be transferred. We have a program called the UPTN, the Utah Pediatric Trauma Network, that one of our surgeons created. And it gives us guidelines on what kind of kids can stay close to home, or, if they need specific neurosurgical consultation that they need to come to Utah. And then we also have the telehealth surgery side where if a kid has appendicitis at an outside hospital, we just direct admit them to our hospital. We recently took over the NICU as well. So those are our surgical patients. So we, the same round, do daily orders, notes up in the NICU. ECMO we do for all of the kids in the hospital, but we either surgically assist the surgeons with that or, grab consent and just kind of be hands-on. And then we monitor those patients every day until we decannulate. And then same with the MTP, that's, NICU, PICU, a surgery floor, the trauma bay, the OR, kind of wherever that gets called, we are the ones that lead that. My background in like research and QI, my two main ones that I would say from a trauma perspective have been, I presented at Western Peds Trauma Conference last summer, and I presented on unintentional window falls. We have a really high population in Utah of this, and we see it a lot, especially during the spring and summer. So I was working with a Stanford resident on kind of gathering data and doing a lot of PR and just like on the news, trying to get it out to the Utah population of just, injury prevention and that sort. And then another big project that I've been working on is button battery ingestion. There's one thing of when they initially present and we have a full protocol, but based on what we were finding clinically, it was if they return to the ED after the ingestion with any kind of like bloody emesis, what should the protocol look like? And we actually designed like a full hybrid OR to deal with these patients. So that's been really interesting and hands-on for me as an NP to really be able to get into research, especially having my doctorate background. I love research and QI, so it's been awesome that I get to do all the clinical and practice as a nurse practitioner, and I have time for research and QI as well. Some additional roles that I have is I run the social media for Western Peds Surgery, the research consortium, which is kind of like a fun side gig that gets me connected to a lot of the Western Peds surgeons and what projects we're doing. I will also be part of the outpatient trauma clinic to follow up with patients and incorporate PTSD training. And then I'm a big member with NAPNAP. I was a national student ambassador, which I definitely encourage joining if you're an NP student in pediatrics, because they are awesome to work with. And I found out that I won like the early advanced practice career award this year. So I will be going to Denver for that, but they definitely have so many opportunities, and it's like just general nurse practitioners and peds, but so many like mentors and groups for trauma as well. So our team is huge from an APP perspective. We actually have 33 now, surgery and trauma APPs, because our scope is so broad, and we just kind of, like I said, run so many different parts of the trauma team between the trauma bay, MTP, ECMO, a lot of these things like to happen at once. So we need a lot of people on, and our team is awesome. And we're a fully like joint group of NPs and PAs. So that's us there. And then some clinical pearls that when I was chatting with my coworkers about like suggestions of what they have, if you're interested in trauma or if you're a new grad, kind of the same as before, but always asking questions. It makes you seem like you're interested, and that you want to find out the nitty-gritty parts of the details. And it also makes the surgeons and the other like APPs trust you, because you're asking the right questions, or even if you're asking the wrong questions, they know kind of where your thought process is. And it's just always so important. Like I said, to network and join organizations. PTS is great. We have like a mentorship group that I would recommend getting involved with. Request clinical opportunities with subspecialty teams. When I did my NP rotations, I did peds ortho, like I said, general surgery, trauma, and burn. And then I also did the rotation with the pain service. And I think those were all super interesting. If I had to do another one, I probably would have done like neurosurgery or maybe like ENT, something like that. So definitely try to go after opportunities with trauma if that's your, main goal in mind. Get involved, especially with research opportunities, because it makes you really understand from like a nationwide what people are doing, what's, the new findings, and just kind of get your hospital on the map, and it makes everyone look good. And then obtain certifications like the trauma charge nurse certification, if, that's kind of your route. I always say ATLS because even if your hospital doesn't need it, it's a great program and teaches you a lot. And that's all I have. Let me know at the end if you have any questions.
Thank you so much. That was great. Now we have Rochelle from Colorado Children's, who is a physician assistant.
Sorry, I'm trying to activate too many screens at once right now. So I'm trying to work on 3. It's not working out for me. Let me get the right screen. Okay. All right. Are you all able to see this? Perfect. So I'm Rochelle Kohler. I'm a PA. I work in pediatric surgery and trauma at Children's Hospital, Colorado. So my pathway to trauma, I didn't put the years of when I went to college on here for really my own personal sanity to make myself feel younger, but it was a while ago. So I started off at the University of Colorado in Boulder, where I got my my BA in, oh geez, there we go. I got my BA in psychology. I will be the first to admit that when I went into college, I had no clue what I wanted to do. I knew I didn't want to do business. But besides that, I was kind of open. I'd always liked psychology and learning kind of the intricacies of the human mind. So I kind of picked that. However, I took kind of pre-med classes because I knew that I also was interested in medicine. For a while, I decided to do pre-med, but then once I understood what it took to be a pediatric surgeon, I realized I did not want to devote my life to that. So I, kind of pushed that away. It wasn't until really my senior year of college that I met a PA and shadowed a PA, and got really excited about the profession. So that's when I really decided that I'd go to PA school. Unfortunately, like I said, that was during my senior year. So I graduated with my degree in psychology, but I needed to do more of the prereqs for PA school. So I went to a local college, which was the Metropolitan State University of Denver, and got a bunch of my prerequisite courses done there, because it might be a little bit of an overachiever. I was a few credits away from getting another degree. So I just went ahead and got another degree in biology with a minor in chemistry during that time. When I was graduating, I got accepted to PA school on the East Coast. While I am from Colorado and a Colorado native, I wanted to get out of the state. I'd always loved the East Coast. And the way they practice medicine was a little different than they did on the Western slope. So I chose to go to school in Massachusetts, and it was a lovely time. The program I went into is actually one of the shorter programs. It was 24 months instead of the typical 27 months or 3 years. So it was drinking from a fire hydrant, essentially, as most people would say. After I graduated from PA school, I came back to Colorado and started working. Well, I'll talk about that, but I started working in adult urology for a year. It was not my favorite for many reasons why I don't have to necessarily state. And then finally got a job at Children's Hospital Colorado in pediatric surgery. I was here for, I started in 2014. And during that time, I did a lot of stuff with education, quality improvement, and leadership. And I decided that I wanted to continue to promote within the academic system. So I went and got my doctorate at A.T. Still University, and got a doctorate of medical science. So like I said, currently working in Denver. The top left picture, that's a picture of our hospital. And then we are part of a bigger medical campus. So there's the children's hospital on the campus, but we also have the adult hospital, which is UC Health, and University of Colorado, which is the actual campus. We also have the VA on this campus too. So becoming a physician assistant or associate, as they now call it, the majority of programs require an undergraduate degree and healthcare experience. The healthcare experience can vary between 6 months and 5 years, and a lot of them want direct patient contact. So from my health experience, I was a clinical nurse assistant, and I worked in the pediatric ICU for about 2 years. And that's how I gained my experience. Other people do EMTs, paramedics, nurse aide. Some people do nursing, etc. It kind of all depends on what you can do and what you want to do. And then usually they don't take like shadow hours, or if you're a scribe, as healthcare experience. And then prerequisite courses. Each program is very unique in some of their courses they require. However, there is a set of basic courses that all of them require. Usually it's biology, chemistry, organic chemistry, physics, and then they may or may not require biochemistry, and they do require anatomy and physiology, but each program is different. On here, I'm happy to share my slides after. There is a link to the PAEA, which is the Physician Assistant Education Association, and they have the list of all of the programs in the United States, and then prerequisite courses and requirements for each of those programs. So feel free to look at that. And then there is also, they have an application checklist, which is really nice because it lays out kind of the timeline for if this is the career path you are choosing. So PA school in general, so most programs will award a master's degree. There are very few programs nowadays that just do a bachelor's degree. I think like nursing, it's kind of moving away from the lower level degrees. And I don't want to say lower level as a master's, so but a bachelor's degree. The majority of PA programs are adult focused, and it's considered a terminal degree. As being a PA, because programs are considered adult focused, you essentially learn across the continuum. So there's no specific certification like in nursing for pediatrics versus adults. With PAs, you are trained to do everything, and so therefore there's no designation. Like I said, typical programs are between 27 months and 3 years. They all have core rotations. Usually it's in family medicine, internal medicine, OB, pediatrics, general surgery, emergency medicine, and psychiatry. And then you have, depending on your program length, you'll have a couple electives to choose what area you want to get more experience in. After you graduate, you have to take a certifying exam, just like any other practice. However, with PAs, you do have to recertify every 10 years. And you can do that either actually by taking a test, or they have actually passed this new pilot where they give you 2 years and you have to answer 25 questions per quarter to recertify. So beyond that, our doctorate programs, these are not required for PAs because the master's is considered a terminal degree. This is really for people who want to pursue PA education or areas outside of clinical practice. There's 8 programs within the United States that offer a doctorate degree, and you usually get awarded some sort of title. So there's a Doctor of Medical Sciences, there's Doctorate of Physician Associate, Doctor of Science in Physician Associate Studies. So they're all kind of the same degree with just a little bit of a different name. So trauma specifically, so my biggest advice to people is during PA school, when you are choosing your electives, if there's an area of interest that you want to learn more about, ask for your electives in that area. So if you're interested in trauma, ask for trauma specific electives. And then during your rotations, like everybody else has discussed, ask questions, show interest, ask if you can do things. Really take learning into your own hands. Don't expect people to force feed you information. If there's something you don't know about, take it into yourself to go read about it, to research it. You would be surprised that that doesn't happen as often as you would think. And so people really appreciate when you know kind of how to take your own learning into hands. Also within surgery, the more you can show interest and the more you know about something, the more you're going to be able to do, and the more procedures and in the OR you're able to help with. And then clinical rotations are your best interviews. A lot of jobs are offered out of rotations. I got multiple job offers throughout my rotations. And that's typically where I give job offers to, are from people who rotate with our team. And then be adaptable, go with the flow of things, figure out how to roll with the punches. And then lastly, consider a postgraduate fellowship program. So PAs, while we do not have to have additional training, fellowship programs are becoming more and more popular because they give you more training in a certain area while also allowing you didactic learning. I am the co-director of our surgical APP fellowship program at Children's. Ours is pediatric focused, in one of, I want to say, 2 in the nation that offer specific focus in pediatric surgical specialties. We have our fellows rotate through pediatric surgery, neurosurgery, ENT, urology, orthopedics, the PICU, our surgical co-management team, and then they have electives where they can choose where they want to go, whether if it's colorectal surgery, plastic surgery, IR, etc. And that's another way to get more training while you are still kind of in the protected student role. Also, hopefully we have positions available after fellowship programs. So day in the life, this is kind of similar to what Michelle and Melissa were talking about. We do morning rounds. Our service is a pretty large service, so we actually had to split it into 2. We have TACS, which is trauma and acute care surgery, and then PSS, which is our pediatric surgery specialty service. No, I won't get into the nuances of that, but one way or another, we have rounds on each service. We also do cover kidney and liver transplants and burn patients, so we have rounds for each of those dedicated areas. And then we round in the PICU. We do daily orders and notes, give patients education, discharges, and then do bedside procedures. For bedside procedures, mostly take things out. We don't put as many things in, whereas other hospitals do other things. So all of our APPs also rotate through outpatient clinic. We do see our trauma patients in our APP clinic. However, we don't have a trauma specific clinic currently. And then growing your career in trauma. I would highly recommend getting involved in local and national organizations. It's a great way to meet people, see what other organizations are doing, and how you can grow your team to compare up to the other well-ran programs. Network, get to know other people, like I said, and then consider ATLS, even if your institution doesn't require it. Like everybody else has said, it's a great learning opportunity. You really get to know the fundamentals of really basic trauma care. And then here's my contact information if anybody has questions.
That was so great. Thank you to all of you guys for presenting. Does anybody have any questions? You can unmute, you can type them in the chat.
Hi, my name's Sarah. I'm a PA student at University of Colorado. I have a question about getting in rotations. If we're not able to get rotations like in the state that we're hoping to practice in, what other suggestions or advice do you guys have for looking for a job in pediatric trauma after we graduate if it doesn't come from a rotation opportunity?
I feel like I was kind of in the same boat. I'm an NP, but I was in Baltimore, and then I'm in Utah now. But I joined, there's like a bunch of pediatric nurse practitioner Facebook groups, and people often like will post job postings there. So I did my clinical rotation in general surgery and trauma in Baltimore, but because of this Facebook group, I was able to connect with a nurse practitioner locally here in Utah, and then kind of move forward in that way with the director and interview, and then I ended up moving here. But yeah, so I used a Facebook group. There's probably, kind of connecting, I think, with LinkedIn as well. But that's how I moved from state to state.
And Sarah, if you're interested in staying in Colorado, email me because we're right across the street. And I can help you with some of that. But I think just some general things when applying for jobs. I review a lot of resumes and cover letters. And your cover letter, while you don't think it is, people look at it, people really do look at it. So if you can make your cover letter so it is directed at the actual job you're applying for, and you can express your interest in that particular job, that goes a long way, especially when applying for any job.
Great, thank you both.
Anybody else out there have any questions, comments? Well, we appreciate everyone taking the time today. We can share the information. I can share my information, Michelle, Melissa, Rochelle, all of our information so that you can reach out to us. I know we did get a question in the chat about the APP mentor program. I think the current cycle is closed, but should be opening up at some point. And so that email should go out through PTS. If you are not a member of PTS and you want to join PTS, we were happy to have you join us, and we can also help send you those links. You can reach out to myself or Johanna, who sent the initial email out for our contact information. But we appreciate all of you guys and have a great day.